want you to close your eyes and imagine you're sitting in a room with 50 of the most influential and powerful people in the world. What would you ask them? What would you want to know about them? What would their goals be like? I want to now introduce you to our personal role model, Helene Gayle. Helene Gayle was born on August 16, 1955 in Buffalo, New York, to her mother, Mariette Gayle, a social worker, and her father, Jacob Gayle, a small business owner. She received her bachelor's in psychology and graduated with honors at Barnard College of Columbia University. She went on to receive her medical degree at the University of Pennsylvania School of Medicine and a master's in public health at Johns Hopkins University School of Hygiene and Public Health. She then dedicated her career to global health and the prevention of infectious diseases. Helene Gayle is our face of modern public health, especially in our fight against COVID. She has been instrumental in bridging the gap between public health and just your general health care.
Helene Gayle's amazing perspective has come from an impressive career, which started at the CDC. For 20 years, she worked for them, focusing on HIV and AIDS. With her work there, she then progressed to work for the Bill and Melinda Gates Foundation, still focusing on HIV and AIDS, until she moved to the McKinsey Social Initiative, which is a nonprofit where she was able to apply her knowledge and travel the world. She became CEO of CARE, which is a humanitarian organization that fights poverty in every respect, and now works as head of the Chicago Community Trust. She raises and allocates funds there to the most important needs that she has been able to see with her experience. To top it all off, she was named Power and Influence Top 50 and holds her place in nonprofit around the world.
Years ago, Helene was asked to help develop the framework of the COVID-19 vaccines when they started talking about it. And given her background in public health and the experiences that she had working for the CDC, she was able to bring a different perspective, and she focused on equity across especially African American populations. And this is a video clip of what she has to say about developing something as global as the COVID-19 vaccine.
To provide a blueprint that could be used by other policymakers, particularly the committee that advises CDC, ultimately the ACIP, the committee that really gives recommendations once there is a vaccine. So that was our starting point, and we had a group of incredible people who covered the waterfront of expertise from epidemiology, statistics, bioethics, demography, epidemiology, public health, clinical medicine, et cetera, because it was really important to have all of those kinds of expertise weigh into this.
And now you know Helene Gayle, among the top 50 most influential and powerful women in the people in the world. Thanks to her contributions towards public health is moving towards a more encompassing focus.